Welcome back. This year's flu season is complicated by the rise in cases of RSV and COVID-19. And today our medical contributor, Dr. Ogechika Alozie with Sunset West Health, is focusing on the flu. Doctor, we want to start with a graphic that shows just how severe this flu season has been so far. Now, this is data from October 1st through November 26th.
Yeah, so what you'll see is that these are some remarkable numbers, whether it's the amount of illnesses, medical visits, hospitalizations, we'll show some graphs, or deaths. This has been a remarkably aggressive flu season.
So how quickly did the flu spread this year?
Well, I think this graph shows it all. We're barely into December, and we're easily, I'd say, 9 to 10 times higher than we are normally, right? And it's just crazy. There's a lot of reasons for that, and we can talk about that later.
And hospitalizations are certainly up as well.
Yeah, 4 times the amount of hospitalizations that we usually have. You can see where that line is, and you can see how high that is. Again, part of it is people not getting shots. Part of it is not being out in the open. There's a host of reasons for that.
Now, I found these next statistics interesting about how people know a flu shot is needed, but not everyone will get one.
I think this is a combination of a host of things, right? 70% of people know that a flu shot is a good idea, but less than half will actually go get them. I think some of the conversation and controversy about COVID has driven a lot of this, and we are where we are. As a public health system, we need to do better to get people to understand that.
And let's talk for a moment, too, about people who are at greater risk of getting the flu.
Yeah, and so we'll talk about a number of groups that I think are at the highest risk. But the problem is that a lot of people, about 40%, don't think the flu shot works. So when I think of who's at risk, it's children, those above 65, you've heard this as a sort of broken record in the past, and pregnant women. It's a group that we don't talk about enough. There's also a group that includes people that have chronic lung disease, people that are overweight, heart disease, diabetic, and those that are immune compromised. Again, we've mentioned those. Those are the groups that should be targeted. They should not, hopefully, be denying themselves a flu shot that will give themselves protection.
And we've talked about this before. What's one of the easiest ways to prevent getting the flu or a cold or anything for that matter?
You know, one of the easiest ways to prevent getting sick from it is to get the vaccine. But one of the easiest ways to prevent transmission is hand hygiene. And I know there's a lot of focus on masks, and masks are great, but even with a mask, most people don't wear them right, and most people touch their faces all the time. So you want to keep your hands clean. When you have clean hands, you're not transferring germs and viruses to your face, and that's how you get sick.
What's the rule of thumb? Sing the happy birthday song twice while you're washing your hands?
Exactly.
All right, now finally, if our viewers need to get a flu shot, here are some local resources.
Yeah, a host of places, whether it's Immunize El Paso or Be Power Flu, your primary care physician, federally qualified health centers. There's a host of places to get it. I think it still is important when we have this sort of tridemic that they call it with influenza, RSV, and SARS-CoV-2. Protect yourself where you can. You may get sick, you probably will get sick, but I don't want to see you in the hospital, and I think that's the key.
Yeah, if you can lessen the impact, that's the major thing.
Absolutely.
ABC-7 medical contributor Dr. Ogechika Alozie, as always, thank you, sir.
Thank you, sir.